Hello. In this video, I'm going to visually explain the pandemic model we've been developing. So it starts with separating the surface of the Earth into hexagons, which are nice because they don't have as much distortion as grid squares would, and they can get pretty much as small as we want. And we've been primarily using level 5 here because that's the highest resolution data sets that we have, though this approach could scale to much smaller hexagons. So we treat each hexagon as a cell and try to model the connections in between cells. The first data set I'm using is a list of all airport flights over the entire world. So that creates a connection between each hexagon for each flight. Second, I have a road data set from NASA, which I've sampled into multiple different levels of hexagons. And as you can see, it gets more and more detailed, but we're still working with a hexagonal lattice. So just with this data, you can start simulating the spread of a pandemic. This would just be through roads, not airports, and this chart represents the connection matrix, where each row is a hexagon and each column is a hexagon cell, and the color represents the strength of the connection between it. So this is the airport connection graph, and you can see the simulation pretty quickly blows up to spread across the world because the airport network is very well connected. With just this connection data, we can start to model the risk profile of every cell hexagon in the world. And this is not just the distance to an airport that you're seeing here, it's distance by road to an airport and by number of roads and by number of flights. So we're capturing some volume there. And so just with connection data, we can model the most connected and least connected cells based on a different weight of roads versus airports, and we can do this at a very high resolution. So this isn't actually simulating any kind of pandemic, it's just telling you how well connected every cell is to every other cell in the world. To model a pandemic, we can use what's called the SIRD model, or compartmental model, which models the populations of susceptible people, infected people, dead people, recovered people. And the three variables we have are the infection rate, the death rate, and the recovery rate, which is just the probability somebody will move from one box to another box at a given time step. So you've probably seen charts like this, which attempt to simplify and model huge populations using just those few variables. And by changing these parameters, we change the shape of the curve. So this is what we would call flattening the curve, which makes the pandemic last longer but lowers the total amount of infected people at any given point in time. You can also change the death rate and recovery rate, which will have similar effects. And what we've seen with coronavirus is that different places in the world have different curves and different variables. So in order to model this, we run a SIRD simulation for every hexagon in the world. So that's over 2 million different models running in parallel and spreading the infection between cells by using our network model. This is the same simulation as before, just with all the buckets overlaid to see how a pandemic that starts in China could spread throughout the world using our network model. We can also change our general parameters, so this is a much more infectious disease where pretty much the entire world gets infected. And so then our death chart just looks like the population chart. We can also try lowering the infection rate and see that each cell recovers before the pandemic can really spread too far. So we have an interactive tool that lets us view the results, live simulations of any of those parameters of different death rates, infection rates, spreading factors, and lets us put in other types of data like population. which can influence the spreading factor or infection rate. And we could also load in demographic information like age or income levels to change the recovery rates, etc. So by running a lot of these simulations with different parameters, we can identify the global hotspots of places that are the most likely to be affected by a pandemic, which is kind of like the population density, but not exactly. So I tested this against real COVID-19 data from the New York Times, and there's a few issues here because this COVID data is per county, which are generally much larger than the hexagons that I'm working with here. So the simulation can actually do a much finer grained data than is actually available, publicly at least. But you can see the hotspots pretty much line up. And so I think it's doing a pretty reasonable job at predicting this outbreak because there's a ton of other factors that aren't being taken into account, such as social distancing, reporting and testing amounts, healthcare availability. Here's a global comparison of the simulation versus the coronavirus. And again, it's important to keep in mind that we're running this simulation at a much higher resolution than most data is being reported at, so it's difficult to compare. If you look at the north coast of Africa, Algeria and Libya, instead of having one circle in the center, because that's the only number we have is a country total, we can actually see that it's likely the cases would be clustered on the northern shore because that's where the population is, and it doesn't make sense to have a big red circle in the middle of the Sahara where no one actually lives. We also can't take this Johns Hopkins map exactly at face value because we don't know what kind of reporting is going on in different countries, what portion of actual cases are reported, or what amount of testing is happening. So take any comparison between these two maps with a grain of salt. In summary, we've got a simplified pandemic simulation that uses a network model based on roads and airports, taking into account the number of roads and the number of flights each day, in conjunction with a SIRD model, which models the susceptible, infected, recovered, and deceased populations in each cell of the surface of the Earth. And these cells can scale down to 1 meter if we want to. And we can run millions of these simulations in parallel for every cell to estimate the amount of deaths that would happen given a pandemic with specific infection and death rates, which can also be changed. So this is going to be a really useful tool to profile the pandemic risk under a variety of circumstances.